Hi everyone, I'm T.A.R.A. Shannon and welcome to T.A.R.A. Talks. This week my guest is Dr. Darrell Menard of Russell, Ontario, a family doctor and sports medicine specialist, and happens to be a family friend that we're very fond of, and he has stitched my children back together more than once. Thank you so much for being here.
You're welcome.
I really appreciate it. You making
My
the
pleasure.
time. So tell our viewers a little bit about what your practice is, just a general idea.
Well, I have a bit of a complicated practice actually, so I don't do like one thing. I have a family practice here in Russell, which we've just left. My wife and I are getting older, so we just stopped doing that in June, and we're transitioning just into a sports medicine practice. I also am the specialist advisor in sports medicine to the Surgeon General, and I still work for him 3 days a week. I cover some national teams, like for Olympic Games or Paralympic Games or Canada Games, those sorts of things. And I do a lot of professional writing, and we do a lot of teaching. There's
been trends now over the years of this moving from traditional type medicine to all kinds of alternative type medicines. So what is something that you've noticed in that change as a doctor with people, the way people are looking at overall wellness in their lives, or self-care?
Yeah. So one of the biggest things that I've seen in terms of a change is what I call Dr. Google. And so people are using the internet more. And there's good with that. There's actually a lot of good with that, but there's also some bad that comes with that. I'll give you an example. Okay. I have a headache. What can headache mean?
I have a brain tumor.
First thing pops up is a brain tumor.
Exactly.
They come flying into the office. I've got to see Dr. Menard immediately because I think I have a brain tumor. And you're going, you have a headache. You've had headaches for years. This is a headache, you know. So that part of Dr. Google is not good. But, you know, what I really like about it is I meet people who come in now who are more educated. I think I have plantar fasciitis, and here's why. I have the pain in the right place. I have this symptom and that symptom, and I tried this and it seems to be making me a little bit better. Is there something more that you can add to the equation? So you have to be careful as a physician not to assume that they've made the right diagnosis. So I say, okay, that's fine. Let's examine you first. I agree with you, T.A.R.A. You have plantar fasciitis and you're doing the right things. I would try adding this. So I enjoy that because that's a partnership, really. And that's what I've seen. Some older people come in, and there's nothing wrong, you know, I'm not dissing them, but they're maybe 70 or 80, and you say, well, I outline, what are your treatment options? And they go, well, what would you recommend, doctor? And I go, well, it really isn't what I want to do, it's what suits you the best. What would you like to do? It really is up to you, doctor. I trust you. Yeah. And so you're going, wow. So you have to skirt between those two realities, people who are not necessarily trusting the medical model as you're the absolute God of knowledge on this stuff, which I don't want to be, I'm not, and I don't want to be considered that. And people who put you into that place, and people then who don't trust traditional medicine at all. And so you're skating this line in between that. And
it's interesting. I've seen it, I kind of experienced it a bit as it's almost like a power shift, because I was raised with like what you're describing about the older people, you know, because I'm old now. Oh, yeah. But that the doctors know. Okay? The doctors know more than I do about my body. So that's the underlying conditioning that happens growing up. So when you run into health challenges, like I've had decades of, you know, you go into it with that, and you're constantly looking out there for, please fix me, please help me, please fix this. And it's a really unfair position to put any family doctor in, because no family doctor could possibly know everything or cover everything.
Absolutely.
And so through this shift, you have the swing of the extreme swing now, that people have no trust in the tradition, they go right to the end of the other side. But the partnership thing to me, I think is such an, I've found that, I've worked into that model with my care team, and it's such a nice place to be. But I had to shift inside myself to take my power back. It was something I was conditioned to take it back and say, no, you know that who knows most about what's happening with my body is me. I may not have the knowledge or medical understanding or the way to communicate it, but I'm the authority when it comes to my body, so that I can walk in to a doctor's office and be a partner, because I'm not giving that power away. Does that make sense?
I can't speak for every other physician, but for me, that's what I want to see. You come in and you say, okay, I got a busy life. I've got 7 children. I've got a singing career, and I'm doing this type of work, and I run a big business, and da-da-da-da-da. I don't have any time to exercise. And I have to look at you and say, T.A.R.A, your body is programmed to need exercise. You need to move, you need to stay active, etc. I can't do this without you. I'm not coming to your house and moving your legs on the treadmill for you, etc. So you have to buy into this. And if we can't partner on that, then I can't really help you. And much the same as I can give you a medicine that you really require, and if you throw it in the toilet on the way home, it's not going to be, I can't help you, you know. So partnering is really important. And I would way prefer to see a patient who's coming in and saying, you know, I've tried this, it didn't work, and have you got an alternative? And you go, yeah, maybe we can. And so let's go back again and tell me what you're experiencing, and maybe we can try this. And I'm delighted when the patient comes in and says, I don't want to hurt your feelings, but I tried this other thing and you didn't mention it, but it really works. And I'm going, why would I be upset about that? Like the whole process is designed, or should be designed, for the outcome to be you feeling better without harming you. And if you figured some of that stuff out on your own and not me, good on you. And it doesn't make me any stupider, but it makes me happy. And you have to park your ego at the door. Like if you're into this because you want to be this godlike creature who, you know, who saves everybody and stuff, you're in for some disappointment. And I don't want to be that. I want to be somebody who, you know, can work with patients and help them to help themselves. You know?
I'm T.A.R.A. Shannon. This has been T.A.R.A. Talks. Thanks for watching.